Hello, my name is Dr. Kent Eichenauer, and along with Dr. Glenn Feltz, we co-created the Psychosocial Risk Factor Survey, also known as the PRFS. This test is a assessment tool that measures a number of different psychological risk factors that we know that can impact our health. These psychological risk factors are depression, anxiety, anger and hostility, social isolation, and then there's also a scale called emotional guardedness. The segment that you're going to view next is Dr. Feltz demonstrating how the PRFS is to be administered to the patients. We hope you enjoy it.
Hello, my name is Dr. Glenn Feltz, and along with Dr. Kent Eichenauer, we created the Psychosocial Risk Factor Survey, the PRFS. This is an assessment tool that is helpful in evaluating a person's possible psychological factors such as depression, anxiety, anger, social isolation, and emotional guardedness. The PRFS is useful in assessing these factors for all kinds of individuals, but particularly for individuals who have physical conditions such as heart disease or pulmonary disease. In this video, I'm going to show you, demonstrate for you, some idea of how you might administer the PRFS to a patient or an individual that you want to administer it to. You need to start first by assessing their reading level. For the PRFS, you need a reading level about 4th grade. Now, if a person can read a newspaper, then they should be able to take this test adequately. So you can ask them to read a copy of a newspaper, just a few sentences, or ask them if they do read a newspaper. And then make sure that they're in a comfortable setting, that they're taking the test kind of by themselves, and that they're not getting coaching from other individuals. And then you respond to them by saying something like this. Hello, John. I want you to take a test that's going to help assess whether or not you may have some psychosocial risk factors that could be affecting your health. It takes about 10 to 15 minutes, and there's about 70 items. You'll see that there's some on the front of the test, as well as some on the back of the test. What I want you to do is respond to these items as a statement of how much you agree with each one or disagree with. You'll see up here that there is a scale for 0 for if you strongly agree, all the way to 4 for if you strongly disagree. Here are the items starting up here, and here's your answer boxes. Just put an X in the correct answer box that goes along with your view for that statement. You're permitted to ask questions when you maybe don't know what a word is or you're not sure what they're trying to ask. And when you're done, just feel free to leave it here or turn it into the staff. When we're finished scoring it, we'll be able to give you the results. Thank you.